Welcome everybody, and thank you all for joining us for this webinar, which is part of our series of presentations funded by the Australian Government Department of Health, Disability and Ageing. And what these webinars and series is all about is how to apply evidence into practice as part of our comorbidity project. My name is Christina Morell. I'm an Associate Professor, Deputy Director of Treatment and Translation Research and Program Lead of Treatment and Translation in Complex Populations at the Matilda Centre for Research in Mental Health and Substance Use at the University of Sydney, where I also lead this project. And I am joined by other members of our team here today as we bring you the last webinar for 2025. Can't believe I'm saying that, which is being presented by Professor Lisa Gibbs. But before I get into it, I'd like to acknowledge and pay respect to the traditional owners of the country of which we're meeting and recognise that we are joining from many traditional lands across Australia today. The traditional owners of the lands that I'm currently on are the Gadigal and Wongal people of the Eora Nation, and I would also like to recognise their continuing connection to land, waters and skies, and acknowledge the same for any traditional owners of the lands that you're all joining us from, and pay respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander and other First Nations people who are joining us today. I'd also like to recognise and acknowledge the many people with lived and living experience of mental health conditions and substance use, as well as their families, carers and loved ones, and chosen families, many of whom have been involved in our project and the development of our resources over many years. You'll all know, if you've been here before, that whether you're joining us live or watching recording, that you're in listen-only mode, which means we can't see or hear you. So I'd like to draw your attention to our Q&A and chat buttons on your screen. If you have any questions for Lisa during the presentation today, please feel free to use the Q&A button. If you have any comments or anything other than questions for Lisa, can you please use the chat? This just helps us keep track of what we pass on to Lisa, or if there are any other questions or questions for support or technical issues that we would want to assist with. The recording and slides will be available for download from our website in the next few days. If you find our Zoom chat distracting, you can have a play around with the settings on your end to disable what messages you see. And to do this, you just need to go to the Zoom desktop app if you have it installed. Click on the settings wheel in the top right-hand corner of your screen and select notifications and sound in the navigation menu. And you can toggle off the option to preview the message or chat. And I think that the link to do that might be in the chat if you want to have a play around with it later, or you can just have a little toggle with that. You can access the webinar library at our website. The link to do that is on screen, and we'll also post that in the chat. And if you have a couple of minutes at the end of the session, please take a moment to let us know if you have any feedback or suggestions for future webinars that you would like to see as part of this series. And now it's my great pleasure to introduce our presenter for today, Professor Lisa Gibbs. Lisa is a Professor of Public Health and Director of the Disaster, Climate and Adversary Unit in the Melbourne School of Population and Global Health, and Academic Lead for Community Resilience and Public Health in the Centre for Disaster Management and Public Safety. Her research focuses on disaster recovery and resilience, particularly relating to the interplay between individual and community level outcomes. Lisa leads a range of flagship research studies, and many of these, along with her practical resources, have directly influenced service and policy decision-making in Australia and internationally. I've not done you justice with that introduction, Lisa, but I'm so glad that you could be here today. Thank you again for joining us, and I'm going to hand over to you to get started when you're ready.
Thanks so much, Christina. And fabulous to be here today. I'm really looking forward to leaving some time at the end so we can have a bit of a chat about what I put forward today and its relevance to your work. And I would also like to add my acknowledgement. I'm joining today from the lands of the Wurundjeri people and Wurrung people of the Kulin Nation, and I'd like to pay my respects to their elders, past and present, and to any Aboriginal and Torres Strait Islander colleagues who have joined the webinar today. I love this artwork that you can see here on the slide. This was created for us in our work, and it represents that connection between people and the places from where they are living, and the sense of hope in the aftermath of disasters and working together towards a recovery experience. There's so much work that could have been relevant to our discussion today. So I've really just had to kind of pull some elements out that I thought might be good conversation starters, just to give you a sense of what's there that you may or may not want to follow up on. So I'll begin by talking about the impacts of disasters on mental health and wellbeing for individuals and communities, the risk factors that contribute to those longer term outcomes, and that will get a bit grim. But at that point, we'll then start talking about what are the protective factors that we can influence that can improve people's experiences, and resources and frameworks that we can draw on. Now, when I started working in this space, it was actually in the immediate aftermath of the Black Saturday bushfires in 2009. And at that time, really, it was a time when experiencing disasters seemed like a relatively rare experience. And while severe, not something that was generally shared outside of that setting. But we now have estimates that over 80% of Australians have experienced a climate-related disaster since 2019. That's 80%. So it's now not a question of have you ever experienced a disaster, but rather are you someone who hasn't experienced a disaster, because that's actually much more rare. And that estimate that I just gave of 80% doesn't include the pandemic experience. So this is a shared reality for all of us. There are many different population groups that we work with specifically, because there are general experiences that are relatively common, but there's also experiences that are specific to certain groups that need additional attention. Today, I've decided to just give you a sense of some particular experiences for older people and for children and young people. But we can talk beyond that if that's of interest in the discussion. And I love this photo. So this is a picture. This woman in the photo is the great-grandmother of that little boy, and it was taken by the grandmother in that family to mark their experiences at 5 years after the 2009 bushfires. And I love this on many different levels, but it really represents that importance of family in the recovery experience, and also the recognition that there are members of families and communities who may need extra support, but they can also offer support, because you can see quite clearly that this little boy is contributing to the well-being of his great-grandmother, and likewise she's contributing to the care of him. And we try and bring that recognition to all of our work, that people have strengths and challenges that they bring to their experience, and what we want to do is enable those strengths. I do want to just reassure any of you on this call who have had an experience of disaster yourself, I will not be showing traumatic images, and I will not be talking about specific traumatic experiences, because I don't want to trigger anything for those who are joining. When we are talking about these groups, and in this presentation, reflecting on older and younger people at different times, I also want to recognise that we don't want to sit in that vulnerable space in terms of who represents that group, because this woman up on the CFA truck is in her early 70s. And so she also represents older people in disasters, and she's been incredibly influential in the experience of the Malakuta community. Her name is Lynn Harwood, and she's a collaborator in our research, and she's given permission to share this image and her story. So another reminder, and likewise, when we're talking about children and young people, these two teenagers made a really important contribution in the wake of the Black Summer bushfires. And I'll tell you more about it later. I just think it's an amazing image, and I'll let that sit with you and see if you can work out what's happening there. But what I'd probably a useful starting point for the discussion about mental health impacts is our research that followed communities for 10 years after the Black Saturday bushfires, to understand how they were being experienced at an individual and community level, and comparing. We worked with over 25 communities, and were able to identify that there was a group of them that were very highly impacted by the bushfires, others that were moderately impacted, and others that effectively acted as comparison rural communities. And we had over 1,000 individual participants in this study. And we've learnt so much from their generosity in being part of the research. One of the core takeaway messages is that people show extraordinary resilience in the wake of crises. And I'm sure you are all familiar with that in your own work. But there is no question, the evidence is very clear in our work and internationally, that if someone experiences a disaster, they are at increased risk of long-term mental health problems. In our work, we found that in the highly affected communities at 3, 5, and 10 years after the bushfires, probable severe mental illness was more than double than what we were seeing in the moderately impacted and low or no impact communities. And it was also more than double what we would normally expect to see generally in a community in Australia. So that shows that long tail to recovery. When we look at the risk factors that might contribute to that sustained challenge of mental health problems, there are some that were already well known. So if you lose someone close in that event, of course, there's the grieving that contributes to mental health challenges. Another significant one that was already known but came through in our research as well is that if in that moment of dealing with the bushfires, someone felt that they were at risk of dying, that's a risk factor for ongoing mental health issues. In addition to that, though, we found that it wasn't just the experience of the disaster itself that creates the risk, it's actually all of the things that come afterwards. In particular, in our research, we were looking at if people lost their property, lost their income, or had a breakdown in relationship. It was a very clear risk factor for longer term mental health issues. And I don't know how many times I've heard people say, I could get through the bushfires again, but I couldn't go through what came afterwards again. Because there are years of frustration and difficulties and just challenges impacting on every part of people's lives. I had a particular look for this presentation on what was showing up in relation to different forms of substance use. And it's not as big a factor as you would expect. In our Beyond Bushfires study, alcohol use, actually we weren't seeing a difference across communities. It was elevated across all of the communities. In the international literature, it's shown to have a small effect on risk of depression in the first year after the disaster. Cigarette use was associated with risk of post-traumatic stress in the 12 to 24-month period, and substance use was shown to have a small effect on risk of depression in the longer term, so after two years. So it's not a huge element of the risk factors that we focus on. One of the issues that was very evident in people's experiences at individual and community level was anger problems. Because emotions are so raw, we do see an elevation of high emotions, and that sort of explosive anger that people can't manage was absolutely elevated, as you can see here. And sometimes in groups that may not be as evident. So women, we were seeing at 5 years after the disaster, were having some difficulties with anger, and people who had lost their work, which is not surprising. So we do see that there's so many reasons to be angry, And we adjusted for that and found that over and above that, if someone is angry, is experiencing this, it is a risk factor for mental health problems. So it's something to pay attention to. So not to diminish the cause of the anger, it's quite legitimate, but to recognise the effect it may be having on the individual and those around them. So we did see that there was increased levels of experiences of threats and violence. And you can see here there was a 7-fold increase for women in those high impact communities. And this is really sort of recent evidence. There hasn't been data on that until this study, and then others have also more recently been able to contribute that, but it's something we need to really be mindful of, that elevation of risk of violence. Now, I mentioned that I would talk occasionally about particular risks for older people and for children and young people. There is emerging evidence that there may be cognitive risks for older adults who experience a disaster. And this is still very new, and it's not confirmed in a broader sense, but something that we need to be paying attention to. So there's one study that showed post-traumatic stress disorder associated with reduced cognitive functioning, another showing a link between psychological distress and dementia, and another more recently in Japan that was able to show increase in anti-dementia medication after floods. So something to be potentially mindful of, that there may be an earlier onset of dementia that could be related to the psychological trauma. It could be related to social disruption and loss of social connection if people are relocated out of their homes and communities. There's a number of different factors, and we're having a closer look at that in our upcoming research. But interestingly, when I went back and had a look at our research findings and looked at the difference for older people, I found that they were showing less anger problems than adults of other ages, less alcohol problems, about the same in terms of their mental health status, once you adjust for the influences on mental health outcomes. And having a really important role in communities in supporting their families in disaster response and recovery, and also taking on really important community volunteer roles. And we all know that those many community organisations are run by retired volunteers, and our research has shown the importance of those community groups, which I'll come to shortly. So just really trying to recognise both the risks for older people in terms of physical and mental health and cognition, but also the strengths in terms of their ability to cope with disruption and to support those around them. When we look at child and adult mental health trajectories, and I'm using the word child as a collective term, it is inclusive of teenagers. We found that the mental health trajectories in the years after a disaster was quite similar to adults in terms of post-traumatic stress disorder, sort of more likely to show signs of depression, but that improves over time. But it's anxiety that we're particularly concerned about, because we do see in younger people that there are elevated symptoms of anxiety compared to adults, and then that becomes chronic. So that's a real concern area for us in this space. And of course, on top of the disaster experiences, we now have very much a shared issue, which is climate anxiety. And this particular study included 10,000 children and young people across 10 countries. So it's a huge study, and it showed that climate anxiety was widespread in children and young people, and to a level that impacted daily functioning. And it was particularly elevated if they didn't believe their government was taking action in relation to climate change. So this is a real issue for children and young people in Australia, and it's a very logical reaction to the reality of climate change and knowing that this is causing more frequent, severe and overlapping disasters. So what we know about the experience of disasters and the recovery experience needs to be understood in the context of these changes. When we look at the international literature again, and this is still just emerging, but looking at studies that show exposure to multiple disasters, it does increase the risk of poor physical and mental health for people who experience multiple disasters. And those disasters might be repeat flooding, for example, so repeats of the same hazard in a given community. They could be cascading events, so drought leading to bushfires, which denudes the landscape, which then is followed by floods, so cascading events, or compound events like the Black Summer bushfires, closely followed by the pandemic. So there are very different scenarios that we see, but the pattern is that the people who are exposed to that show a higher risk of mental health and physical health outcomes, which in a sense is pretty obvious, but we also have a shared understanding, I would suggest, in the general public that what doesn't kill you makes you stronger. So there's that belief in resilience, I guess, or learnt capacity to deal with experiences. And there's some truth in that. I mean, I've absolutely met people and interviewed families where they had had an earlier experience of bushfires, which helped them understand what might happen and then therefore be more prepared the next time. But if the first event is really damaging in terms of your physical and mental health, and the second event comes along and you're not back at full strength, actually you're in a more vulnerable position and you are at a higher risk. And this is what we're recognising in this evidence. So I apologise if everybody is now feeling very flat at the presentation of these findings. And I want to reassure you that what we're focusing on is how do we make a difference? What can we learn from these experiences to leverage better outcomes for people and communities? And there's so many different ways that can be done. I'm just giving you a few examples today. The first is these 5 essential elements of intervention after a mass trauma event. This was developed by expert consensus. It now underpins psychological first aid, so I'm sure many of you have come across it. But I always like to share it because it's something that we can all do in our everyday life to support others. And it says that these 5 things are likely to make a positive difference for people. To restore a sense of safety, to restore a sense of calm, a sense of self and community efficacy. So I can manage this situation, I can get there, and my community is going to get through this. And we have a sense of how we're going to do that. That connectedness to others is a really powerful element of the shared experience and working through it. And of course, a sense of hope that things will become better. The world around you might be changed, but there is a way forward with a positive outcome ahead. The other thing I want to note before I go on to some community level factors is that there is evidence that we see post-traumatic growth experiences for people after these major traumatic events. And this can happen in a number of different ways. People can see their life differently and really value what is most important to them in their life. So it gives them a new way of looking at their life. There may be new possibilities that have come out of this dramatic experience, including perhaps a new career path or a new relationship, for example, or new friendships in the community that people can really value and appreciate. People can be proud of what they have been able to get managed, and that can change their image of themselves. Those enhanced relationships that I spoke of, people can come together. And also for some people, there's a sense of spiritual growth. So there are many different ways that people can experience post-traumatic growth, and they're often wary of talking about it in a community context because they're conscious that others are struggling and they're respectful of that. And there can be a dampening of a mood for that reason. And yet what our research has shown is that it's not that people might experience post-traumatic stress or post-traumatic growth. They actually tend to come together. So the people who are most likely to experience post-traumatic growth are the ones that have had really intense experiences. It's not associated with depression or other forms of mental illness, but we definitely see an association with post-traumatic stress, with higher degrees of property loss in medium and high bushfire affected communities. Women, I'm not sure why, are more likely to experience post-traumatic growth, and also people who feel a strong connection themselves with their community. It's not necessarily that the community has a high level of cohesion, but that person is feeling a strong sense of community, and that seems to be associated with the post-traumatic growth experience. You won't be surprised to hear that our research showed that social ties matter. The more people you are close to, the better your mental health outcomes are likely to be. But it is complicated, of course, because people are complicated. We found that if you're living with someone else, you're likely to have better mental health outcomes, but it does depend on the nature of the relationship that you have with that one person or with others in the household. In this paper, you can see listed at the bottom, Colin Gallagher led an analysis that looked at couples and their relationship, and he found that the influence they had on each other's mental health was dependent on the gender roles and the attachment styles. So when I'm talking about attachment styles, that of course means, people may have a secure attachment, or they may demonstrate avoidant attachment where they avoid emotional encounters, or anxious attachment where they worry about the relationship and the person, and that becomes problematic in itself. So there are different elements underpinning that, and if that is of particular interest to you, I would recommend the paper that is mentioned at the bottom of that screen, which will be shared afterwards. Other patterns that were interesting was that, as I said, the people who had lots of people they were close to, generally had better mental health and wellbeing outcomes. People who were reporting symptoms of depression tended to be connected to other people who were also had likely depression. And we don't know if that's because they're drawn to people who are responding to the experience in a similar way to them, or if there's a contagion effect from those responses. And it's probably a bit of both. For people who showed signs of post-traumatic stress disorder, we found that then social networks were fractured. So the people they were close to didn't know the other people they were close to. And so they may have been missing out on that benefit of when, you're talking about a friend and you say, have you seen Richard lately? And the other one goes, no, I haven't. And then you kind of realize that perhaps there's something going on and you might go and check. So there's different social network patterns that we're seeing dependent on the mental health status of the person. But group membership came through as really beneficial. If you belong to one or two or three community groups, you get additional benefits for each group in terms of your mental health and wellbeing outcomes 3-5 years after the disaster event. So that was quite marked, and it didn't really matter what type of community group it was. It was about being part of a community group. The risk factor really came in if you were belonging to more than that. So, you know, if you get up to around 4, 5, 6 groups, it starts to become a burden. And we suspect that they are often the people who are the organisers. So they're the treasurer for the footy club. They organise the speakers for Rotary. They're the fundraiser for the kindergarten. We all know those people who keep these groups going. But in a community crisis, that can become a burden. So we do advocate for sharing the load. And the other finding that was really important and interesting was that if you belong in a community where lots of people belong to local groups, that wasn't only a benefit to the group members, there was a spillover benefit to other people living in that community. And so what we assume is that there may be some sort of general heightened level of trust and reciprocity in those communities because there's so many connections between people, and there's a broader benefit to that. And these are things that we can think about contributing to just build the everyday benefits for communities, but also to strengthen communities in case of future crises. The other thing that came through, I'm kind of laughing at the moment because I actually remember when there was this kind of breakthrough aha moment about the importance of the strong attachment to the natural environment. And look, we know the benefits of being connected to the natural environment, but we were out in these communities exploring social connections. And so we're talking to people, exploring what's important to them in their lives. And this is in the years after the disaster, and people kept talking to us about their local landscape, like because we were taking photos of what was important to them, and they kept pointing at trees. And so we went back into our data and ran analyses, and we found that if people reported a strong attachment to the natural environment, we were seeing better outcomes on every mental health and wellbeing measure we looked at. Really powerful, and absolutely an opportunity to recommend nature-based recovery strategies. When we're looking again at sort of particular issues for older people and younger people, well, the international literature shows that older people supporting others post-disaster show better mental health outcomes. And I think that's just a really important reminder, and links to the role that older people often have in those community organisations. But I'm also reminded of my colleague, Professor Junko Otani. I work with her with research in Japan, and they refer to young, old, and old in thinking about these issues. And this is a really nice example for old contributions, if you like. And apologies if that phrasing is doesn't work for you, but I think it's a helpful distinction. So I was talking to Red Cross, and they were telling me that they'll often have older people who have, in their lives been really involved in volunteering, but they've got to a stage of their life where they're just not mobile anymore, and they're not able to kind of come down and help at their recovery centre or visit people or whatever. But they can pick up the phone. And Red Cross have developed this lovely service called Telecross to support older people living on their own who are feeling isolated. And they match them to someone who will ring them once at the same time every day, just to check in, have a little chat, and ensure that they feel connected. And at times like heat waves, where there are sort of safety behaviours that they need to be thinking about, they'll remind them of those sorts of things. And if they're not answering the phone, they send someone around to check on them. And that's actually been really important in some situations. But the thing I love about this is when you look at this photo, you don't know if the person making that call, well, if they're the person making the call as the volunteer or the person receiving the call, because they're peers. And as older people, they're still able to make a contribution to others. And so this is the sort of thing that we can be thinking about in building the well-being and the connectedness of older people in disaster experiences. And I promised to show you, to come back to this and tell you what this was about. So this is in the wake of the Black Summer bushfires. These two teenage boys had to evacuate from their home with their mum and go to the Bega Showgrounds to shelter. It was a sort of stay safe site, and people were there for days waiting to see what the bushfires did. So the orange is the bushfire smoke, and you can see one of the boys is wearing a mask to protect against the bushfire smoke. But they happened to be performers at festivals. And of course, when they packed all their most precious things in the car to evacuate from home, they packed their performing gear. And they get to the evacuation centre and realise that when you're in these places, it's not just scary, it's also really tedious. People are waiting there for days and the kids have got nothing to do. So they decided to put on a performance for people to distract them from what was going on and give them something positive to think about. And so you can see how amazing it is. And they also ran workshops for the kids with juggling and stilt walking and made a really important difference for the families who were experiencing that really difficult time. And so I always try and remember that when we're thinking for any of our roles with the people we're working with, what are the strengths they bring to a space? What can they contribute? If this is relevant to you and your work, there are so many resources and frameworks that can be really helpful. At the end of this, you'll see on my sort of final slide, there's a QR code to our website, and there's, you're welcome to kind of scroll through and see what you can find there. But these are some things that may be of immediate relevance. So there's the National Disaster Mental Health and Wellbeing Framework, and you can just Google that and find it. It has the sort of a variant of the stepped care model that recognises that there's a small percentage at the top of the pyramid of people who have particular mental health conditions that will need treatment and support. But there'll also be other people who wouldn't normally need that, but may have experienced trauma and would benefit from sort of particular focus support. And then there may be strategies and programs that would benefit everyone at community level and in families to support well-being and to protect against the elevation of potential mental health difficulties. And then there's just the practical support, the daily issues that need to be addressed. So that's a potentially useful reminder of the multi-layered approach in this space. This report that I mentioned earlier is set up with just very basic infographics, core messages from the research, but with the underlying references cited, so that if people just want to have a quick grab at what are some of the risk and protective factors, they can grab it from here and use it to make a case if you're trying to attract funding or resources. We're really happy for you to cut and paste and cite relevant references to support what you're trying to achieve. And similarly, you can do the same with this. So the last one I just showed you, the Beyond Bushfires, comes from our particular research. This guide to disaster recovery capitals, we've gone beyond that to draw on other research that is relevant to Australia and Aotearoa, New Zealand. And while the Beyond Bushfires report gives specific recommendations, This one is really meant to be used as a guide to informed discussions so people can make decisions within the context that they're in. And this was co-developed with 21 agencies so that it's really relevant to recovery workers in the space. And it builds on this notion that disasters affect every aspect of your life, and you've got to draw on capitals across all of these spaces to be able to get through what is happening. And it's a helpful reminder for if you're working in the space and your particular expertise may be in human capital, so mental health, knowledge, skills, but there's all these other things happening. So who are you drawing on and who are you working with to make sure there's a holistic approach? And we've worked with the First Nations partners to develop representations and messaging in Australia and Aotearoa, New Zealand as well. But my colleagues took this to their work with young people, and the young people decided that they could do it. They would prefer a representation of these capitals as superpowers. And there's been just this fabulous program of work around climate superpowers that has emerged from that with a fabulous website entry into all of these resources about identifying, well, what are your climate superpowers and how can you use that if you're trying to learn about climate change, trying to take climate action and also to take care of yourself and those around you. So that's a whole body of work that is probably another conversation. But I will just rest here for a moment because I know I've breezed over so much, and some of it may or may not be relevant for you and your work and your interests. But if it's something you would like to build on and learn more about, we do offer a short course that is really an introduction to the tenets of disaster recovery. And if people are in a low income workplace or community, we do offer scholarship places, two places for every course. So I will stop there. And really happy to hear what people have to say. As I mentioned earlier, this QR code will take you to our website, and I believe the slides will be shared so that you can follow up with that afterwards. Thank you.
Thank you so much, Lisa. An incredibly informative webinar. I mean, it's not good news that we have all of this increasing work to draw on, but your research that has come out of it and all the disasters is so beneficial, isn't it? Especially in terms of how do we prepare and what protective factors. So I really enjoyed that. Thank you so much.
Thanks,
so we
Sally.
do have some time. Does anybody have a question that you would like to ask Lisa? Now is your chance. You can write it in the chat. So we've got lots of people thanking you, Lisa. We also have a QR. But while everyone is thinking of any questions they may have, I'll kick us off, Lisa, and I'll kick us off with an easy one.
Thank
which
you.
is when you were talking about the protective factors and the way you mentioned the Japanese approach of the young old and the old, I just wondered what is the kind of age brackets around that? When we're talking about the old and protective factors, and I love that you talked about the telecross as well. Is there an age that we are in that old bracket when we're looking at the research?
Yes, it's slightly confronting, Sally. I just turned 60. And there's some debate around that, but probably more commonly over 65 is considered older.
Right.
And of course, that's why we need to differentiate because as you would know, that's also a really active age for many. It's interesting. I've just last month was at an aging conference in Japan, and I was asked to present on aging and disasters. And there was a session on the last day, and one of our students from the University of Osaka was presenting, and there'd been many sessions in the conference about, you know, not assuming everybody's vulnerable and so on. But Yushuan, in her presentation, she gently pointed out that while everyone's talking about the fact that, you know, we've got to think about older people and supporting them, everyone in a position of power at the conference was an older person. And here she is as a young researcher. So, yeah, the reality is that older people are often the most powerful and also the most vulnerable. So there's this kind of strange balance between the two that we've got to navigate.
Yeah. And in the telecross service that you talked about, and you talked about it, I love the photograph when you said we don't know which one this is, the recipient or the caller. Is there an age that you have to be a telecross volunteer?
No, it's not. It's not only older people who are the volunteers, but apparently there are about 30% of the volunteers are in that old bracket,
In the older bracket.
which I think is wonderful, and it's a real strength of that program.
Absolutely. Thank you. Somebody has posted a picture, so somebody's asked here, we've got lots of thank yous, so thank yous. And Miroslav has asked, has anyone looked at the impact of politics on people's resilience? I mean, we might not want to get too much into politics, but do you have any thoughts on that, Lisa?
Oh, that's such an interesting question, and it's not my area of expertise. I can, you know, as I mentioned earlier, the studies of climate anxiety among young people, it was a specific part of their research where they asked them about whether they felt their government was taking appropriate action for climate change, and there was a very clear effect that if they didn't have confidence that their government was taking action, they were more likely to have higher levels of anxiety. So there was a very clear relationship there. One of the spaces that we're working in, one of my colleagues, Phoebe Quinn, is doing her PhD on civic technology or digital democracy. So it's about how do you engage in collective decision making in disaster contexts. And this is a tool that's being used by some governments to enable citizens to contribute to decision making, but it can also operate separately to government involvement. And so when we talk about political capital in the disaster recovery space, it doesn't just mean the role of governments, it's the capacity to influence decision making and the capacity to bring resources into the community. And so we're exploring different tools for that and different ways the community can have agency over what takes place.
Yeah, and I think that was a great take-home point for us all, as you mentioned. It really enhances our collaborative approach, and knowing that is the way to go, particularly when we're meeting people who have experienced some form of disaster, because there are all these different capitals, and we may, as you said, be working on the human capital thought, but just to keep in our minds how important it is to connect in with other services to help with the other aspects of capital, the other aspects of life affected, I think is a really good message for us all working with affected people potentially here.
Yes.
I do have a question here from Jeff. I'm going to not read the whole thing out, but I think it's a really good point, Jeff. So Jeff says, meaningful connection is key for all things mental health. I'm a community link facilitator working within a large national mental health services. My role focuses on promoting meaningful social connection, community development, facilitating peer groups, as well as working with individuals to help reduce barriers to their sense of belonging. We do a lot of nature-based social connection outdoor activities, which has profound positive impacts. And you mentioned this, it is a really interesting area to dig into. Jeff says they find there's an 8-to-1 cost-benefit ratio when taking this evidence-based cost-effective approach. Do you have any suggestions in how we can sort of help organizational management to implement more when perhaps Jeff is saying in his experience we're not getting the dollars towards that kind of health intervention?
Yeah, I'm delighted to hear that's the work you're doing, Jeff. It's so important. Look, I think the recognition of the importance is still growing, and there's some efforts of, for nature prescribing as a protective strategy. All I can suggest is in the disaster recovery capitals, I'm not sure how many papers we've referenced in there, but feel free to use that to make your case, to cut and paste. And you may be well in touch with the evidence already. I don't know what your particular work circumstances are, but if you're not, we try and make it easy for you to shore up your applications, your funding applications, and so on, and be confident that we are also advocating for work in that space alongside partners like Red Cross and others that have influence.
Yeah, thank you. Cindy has a question here, which I think is a really great one. So she says, in her experience during a recent disaster in her area, mental health clinicians were deployed more to have a chat and be there in that connection piece. And the initial response was there, but then it seemed like afterwards everyone was pulled out. The ongoing supports aren't there as much. Is this an area that could be improved in working in this area and build? How do we start to build that longer term support service?
It's this is complex. So firstly, it's funding dependent. So organisations tend to get short-term funding. So one of the big things that came out of the Beyond Bushfires study was you need to have this was what we were saying, the evidence shows there needs to be a 5-year recovery plan at least, and that should be accounting for the transition from external services to local services. So we do, we have been making a case for that. There has been a shift to longer services, but not long enough. There's always a tension between external and local, and sometimes it's not helpful to have external, but sometimes it is if people have a sense of privacy around their experience. Some of the things that can help when there aren't individual services are things like the community education sessions that Rob Gordon runs, or these are kind of leading trauma psychologists in Australia, so collective trauma, Rob Gordon and David Younger, where you get them out every 6 months to say, about this time, this is what you may be seeing in your community. You're not going crazy. This is a thing that happens, and these are some things that you might find is helpful. And what we find is that people will often come to those community education sessions because there's other things that are happening there where they may not go to individual services. So there are various strategies, but you're right, there's never enough services for the need. And this is where we're trying to identify these other protective strategies that can be implemented at a community level that don't require those specialist qualifications.
Jeff, who we spoke about the nature prescribing, says thank you, and that he's talking about it at a conference in Brisbane. So good luck, Jeff, and go well.
Absolutely, go and spread the word.
Yes, yes. I'm going to hand over to Chris to close us out because I've just got my eye on the time, but I just want to let everybody know that we do have Lisa kindly coming back next week as part of a panel discussion where we're going to dig into this deeper, and we're very to have Anne Leadbeater, OAM, who was awarded her Order of Australia for services to the community following the 2019 bushfires, and Alex Howard, who is the Director of Disasters and Public Health Emergencies at Phoenix, Australia. So for those of you who are in our community of practice, this will be a session that you can come and attend and ask questions to the panel. So if we didn't get to your question today, please note we will read them all, we will send them all to our panels, and we will address them there. We'll have another opportunity. But I want to say my deep thank yous to you, Lisa, for this. It's been really great, and I'm going to pass us over to Chris now.
Thanks,
Thank
Sally.
you so much.
Thank you. And I want to second that. And I also wanted to let you all know that you can find out more information about our guidelines, which this webinar series is linked to, and our other resources at our website there on screen. And for you practitioners there, I will mention again what Sally has just said, that our online community of practice, also funded by the Australian Government Department of Health, Disability and Ageing, is available. This is professionals in Australia who work with people experiencing co-occurring alcohol and other drug use and mental health conditions. It is free. You can find out more by going to our or navigating to it via our comorbidity guidelines homepage, and the link is on screen there. I think Madhu has put it in the chat as well. And Lisa will be joining us there next week, along with an excellent panel. So thank you again for having joined us for this webinar. If you're interested in having a look at our library of previous webinars, watching this one again, catching up on anything that you might have missed, or sharing it with your colleagues, you can do it at our website. As I mentioned, this is our last webinar for this year, but we will be back next year, and I hope you can join us when we return. But until then, thank you again for joining us today. Thank you again so much, Lisa. Please take care over the end of year break, and please enjoy the rest of your day.